What if despite your best efforts to manage your glaucoma, it continues to worsen? You're taking your prescribed medications and following your doctor's guidance, yet your symptoms seem to be getting more severe. While this can feel discouraging, there are several reasons why it may happen. In today's video, we'll explore why your glaucoma might still be progressing even with treatment, and what you can do about it. From medication resistance to overlooked factors or even misdiagnosis, we'll dive into the most common causes and offer actionable solutions. By the end, you'll better understand why your treatment plan isn't working as expected and what steps you can take to regain control over your eye health. Stick with me as we uncover the answers together. Glaucoma refers to eye conditions that damage the optic nerve, which transmits visual information to the brain. The most common cause of this damage is high intraocular pressure, IOP, which pushes against the optic nerve. The problem is, glaucoma often has no early symptoms, which is why it's called the silent thief of sight. Since glaucoma can progress without noticeable signs, regular checkups are crucial for early detection. If caught early, treatment can prevent significant damage and blindness. The primary treatment for glaucoma is eye drops that lower intraocular pressure. These are often effective if the condition is diagnosed early. If eye drops aren't enough, treatments like laser therapy or surgery may be considered to manage the pressure. For some, a combination of treatments may be needed, as the key to managing glaucoma is controlling the pressure. On a larger scale, glaucoma is a global health issue, affecting over 3 million Americans and being the second leading cause of blindness worldwide. As the population ages, these numbers are expected to increase. Even with treatment, some people still experience worsening symptoms. So why does this happen? Let's explore that next. Number 1. Non-adherence to treatment. Non-adherence to treatment is a major challenge in managing glaucoma. It might seem easy to skip a dose, especially when your eyes feel fine, but missing doses can impact the effectiveness of your treatment. Even missing a few doses can raise intraocular pressure, worsening glaucoma over time, even without noticeable symptoms. Consistency is crucial. Just like you wouldn't skip brushing your teeth because you don't have a toothache, don't skip your eye drops if you don't feel symptoms. Regular care is essential for maintaining eye health. A 2019 study found that up to 50% of glaucoma patients don't follow their prescribed treatment, leading to worse outcomes. Missing even a few doses can cause a rise in intraocular pressure, reducing the treatment's effectiveness. Non-adherence is a key risk factor for glaucoma progression, so if remembering your medication is difficult, talk to your doctor. Solutions like setting reminders, using a pill organizer, or trying longer-acting medications can help improve adherence and better manage your condition. Number 2. Incorrect use of eye drops. Even if you're using the right medication, it won't work as intended if the drops aren't applied correctly. And that's more common than it sounds. Improper use of eye drops is one of the leading reasons glaucoma treatments fall short. Timing matters. When using multiple medications, not waiting long enough between drops can cause one to wash out the other, reducing absorption. Using too little or too much can also affect results. The way you apply the drops plays a big role in how well the treatment works. A 2018 study published in Ophthalmology revealed that nearly 40% of glaucoma patients weren't using their drops correctly. Small mistakes, like forgetting to shake the bottle, missing the eye, or not applying enough, can keep intraocular pressure from being properly controlled. Another common issue is touching the dropper tip to the eye, which can introduce bacteria and cause infection. A safer method? Tilt your head back, gently pull down your lower eyelid, and apply a single drop without touching your eye. If you're ever unsure about the process, don't hesitate to ask your doctor or pharmacist for help. A few small adjustments in how you use your drops can make a big difference in keeping your eye pressure stable and protecting your vision. Number 3. Medication resistance. Have you been following your doctor's instructions, yet noticed your glaucoma symptoms worsening? This could be due to medication resistance. Over time, the body can develop a tolerance to medications, reducing their effectiveness. This is common for patients on the same medication for years. Think of it like muscle adaptation to exercise. Your body adjusts, and to keep managing intraocular pressure effectively, you may need a medication change. Medication resistance doesn't mean treatment failure, just that your body has adapted, and a new approach is needed. Research in the British Journal of Ophthalmology shows that long-term use of the same glaucoma medication often leads to decreased effectiveness. For example, prostaglandin analogs may lose their ability to lower intraocular pressure over time. If your medication isn't working as well, consult your doctor. There are alternative treatments, combinations, or even options like laser therapy or surgery to help manage your eye pressure. Number 4. Progression of the disease despite treatment. Sometimes, glaucoma can worsen despite following the right treatments. Even with effective medications and strict adherence to your plan, the disease might progress, which can be frustrating, especially when intraocular pressure is well controlled. While managing eye pressure is important, it's not the only factor in controlling glaucoma. The optic nerve damage caused by glaucoma is progressive and can continue even with normal intraocular pressure. For example, normal tension glaucoma can damage the optic nerve despite normal eye pressure, making it harder to manage. If symptoms worsen despite treatment, it might be due to the nature of the disease itself, not a failure on your part. Staying in close contact with your doctor is crucial for adjusting your treatment plan. Additional therapies, or even surgery, may be necessary to slow progression. Research from the Glaucoma Research Foundation shows that normal tension glaucoma patients can experience ongoing optic nerve damage even with controlled eye pressure. Factors like blood flow to the optic nerve or genetic predispositions can also contribute. This highlights the need for personalized treatment. Some patients may need more than just medication. Lifestyle changes, additional treatments, or surgery could be necessary to manage the condition effectively. Number 5. Misdiagnosis or incomplete diagnosis. One reason glaucoma might worsen despite treatment is misdiagnosis or incomplete diagnosis. Glaucoma isn't a single condition, it includes various types that behave differently. For example, angle closure or normal tension glaucoma are harder to diagnose and may not respond to standard treatments like open-angle glaucoma. Misdiagnosis can happen because some types, like normal tension glaucoma, don't show obvious symptoms, and eye pressure may appear normal despite damage. This makes accurate diagnosis and treatment difficult, which is why specialized tests and expert care are crucial. If your treatment isn't working, it could be due to an incorrect diagnosis. An experienced eye care professional is essential for identifying the right type of glaucoma. If standard treatments aren't improving your condition, consider revisiting your diagnosis. A 2020 JAMA Ophthalmology article noted that many patients with less common types of glaucoma were misdiagnosed, delaying proper treatment. Without the correct diagnosis, treatment may not be effective, and symptoms can worsen. In such cases, getting a second opinion or more detailed testing, like optic nerve imaging, visual field testing, or specialized eye pressure monitoring, can help ensure the right treatment plan. Number 6. Other health conditions interfering with treatment. Other health conditions like diabetes, hypertension, or autoimmune diseases can complicate glaucoma management. For example, diabetes can affect blood vessels in the eye, and hypertension can influence eye pressure, making it harder to control glaucoma. Certain medications for these conditions may also interfere with glaucoma treatments. Drugs for high blood pressure or heart issues can raise intraocular pressure, making glaucoma harder to manage. It's crucial to discuss all medications with your healthcare providers to avoid interactions. Managing multiple health issues often requires a coordinated treatment plan. For instance, someone with both glaucoma and high blood pressure may need a plan that addresses both conditions. A holistic approach ensures effective management of both glaucoma and other health concerns. Research in The Lancet shows that up to 30% of glaucoma patients have other conditions that complicate treatment. Working closely with both your eye doctor and other specialists helps ensure all health concerns are addressed while optimizing your glaucoma treatment. Number 7. Changes in your lifestyle or environment. Your lifestyle and environment can greatly affect glaucoma. Stress, poor sleep, and environmental factors like excessive sunlight can worsen symptoms. Stress raises both blood pressure and intraocular pressure, making glaucoma harder to manage. When stressed or sleep-deprived, it's harder to control eye pressure. Poor sleep disrupts body balance, potentially raising intraocular pressure. Environmental factors like bright sunlight or harsh lighting can cause eye strain, worsening glaucoma. While sunlight alone doesn't raise eye pressure, prolonged exposure can make management more difficult. UV-protected sunglasses and reducing harsh lighting can help. A 2021 study in ocular surgery and lasers found that chronic stress and poor sleep are linked to higher intraocular pressure. These factors can also increase the risk of high blood pressure, a glaucoma risk factor. To manage these effects, try stress relief techniques like meditation, yoga, or exercise. Aim for 7 to 8 hours of quality sleep each night to improve both your health and your glaucoma management. Managing glaucoma is about more than medication. It's about supporting your eye health with a healthy lifestyle. What you can do to improve your treatment plan. Number 1. Communicate with your doctor. Managing glaucoma can be challenging, even when you follow your doctor's advice. If you notice your symptoms worsening or not improving, it's time to talk to your doctor. Open communication is essential for adjusting your treatment plan. Don't wait until your next appointment. Schedule a follow-up if needed and discuss any changes in your symptoms, like blurry vision or trouble seeing in low light. These could signal that your current treatment isn't working. Your doctor might adjust your medication, switch treatments, or even consider surgery. Be proactive and ask about other options, such as newer medications or laser therapy, as glaucoma treatments continue to evolve. Number 2. Explore new treatment options. If your current treatment isn't enough, explore other options. Newer laser therapies like selective laser trabeculoplasty, SLT, and minimally invasive surgeries can help lower intraocular pressure where traditional treatments fall short. SLT targets the eye's drainage system with a low-risk procedure and quick recovery. For more advanced glaucoma, surgery like trabeculectomy may be necessary to create a new drainage channel. Additionally, ask your doctor about the latest medications, as pharmaceutical research is continually improving treatment options. Number 3. Make lifestyle changes. Managing glaucoma goes beyond medications. It's about a holistic approach to your health. Start with a diet rich in antioxidants from fruits and vegetables like spinach, kale, and blueberries. Omega-3 fatty acids from fish such as salmon can also support eye health. Regular exercise, like walking or swimming, can lower intraocular pressure and boost circulation. Stress management is also vital, as stress can raise eye pressure. Relaxation techniques, meditation, or hobbies can help. Finally, prioritize quality sleep, 7 to 8 hours each night. Rest helps regulate blood pressure and maintain stable intraocular pressure. By combining lifestyle changes with medical treatments, you can better manage glaucoma and support your eye health. You've now learned about the reasons your glaucoma might be worsening, even with a treatment plan in place. It's time to take action. How will you communicate with your doctor moving forward? Could small lifestyle changes make a difference in managing your glaucoma? What's the first step you'll take to improve your eye health? If this video has been helpful, don't forget to like, share, and subscribe for more valuable health tips. Tap the notification bell to stay updated on our latest content. Your journey to better glaucoma management continues here. I'll be with you every step of the way. Check out the next video on your screen to keep learning how to protect your vision and live your healthiest life. See you there.